The swelling agents are natural fibers or grains that remain in the intestine, soak up water, and expand. The water which is retained then softens the stool, and swelling action distends the rectum and initiates defecation. Osmotic or saline laxatives are a mixture of sodium and magnesium salts, and these ions attract water back into the GI tract. Same action. Once we bring that water in, we're swelling and we're building up the amount of stool and kind of pushing it along. Lactulose is a combination of sugars that promote the same exact action. As you can see, we kind of have a similar idea, bringing water back into the intestines. So lactulose brings water back into the intestines as well. So we've covered three: osmotic agents, swelling agents, and lactulose. Another one you'll hear referred to as PEG, P-E-G, polyethylene glycol, is a non-absorbable solution containing sodium sulfate that acts in a similar manner. It draws water into the intestines. This is used commonly as a bowel prep for colonoscopy. And what they'll do is they'll have a huge jar of medication, they mix it with water, and that patient will drink it over a certain period of time. And we're talking about, I want to say about 4 liters. So it's a pretty big amount, and all that's doing is drawing all of the, taking everything that's in the intestine and flushing it out, because normally they don't eat after they've taken that medication. Emollients are laxatives that act on the stool to permit water to penetrate the fecal mass. Basically, they're oily substances, and it allows water to pass into the stool. Same exact effect. We're bringing water in, we're swelling up the feces, and it's going to move right along. Chloride channel activators are the newest class of drugs approved by the FDA for chronic constipation and IBS. Lubiprostone is the first drug that was approved, and that brand name for that one is Amitiza. And it acts locally in the membrane of the intestine. Chloride channels are pore-forming proteins that are critical to fluid support or fluid transport and maintaining cell volume and pH. So lubiprostone opens these chloride channels and allows chloride to enter into the intestine. By the principles of osmosis, where chloride goes, water will follow. So it's basically the water following the chloride into the cell, and again, the same process as before. Once we introduce water, and you guys know what's going to happen. So lubiprostone is broken down in the stomach and small intestine, so very little is systemically absorbed. Common side effects with this medication: headache, diarrhea, and nausea. Usually it's 24 micrograms taken twice daily with food and water. The next one they cover is mu-opioid receptor antagonists. And this is a pretty new class. There's only one drug in it called Relistor, and it's used to treat opioid-induced constipation. So patients who are on chronic opioids, such as Percocet, OxyContin, etc., will be constipated. That is one of the side effects of those medications. This medication blocks the receptors without affecting the response to the pain medications. So it blocks mu-opioid receptors and treats constipation that is caused by mu-opioid agonists, which are your pain medications. Hope that made sense for you. So Percocet, OxyContin, etc. act on mu-opioid receptors. One of the side effects is constipation. This medication, methylnaltrexone, blocks that, but only in certain parts of the body. It doesn't affect the pain response. So these patients still have pain relief, but now their constipation is relieved as well. It's given by injection, given usually every other day, but can be given up to once a day. So most of these laxatives that we talked about, with the exception of methylnaltrexone, are administered orally. The onset varies, and you can cover that on page 576. Some of them take a little longer than others, and some of them are relatively quick, within minutes. I think that is covered on page 575 in a chart as a whole. It's actually kind of good to know, because if you're looking for something that works really quick, you'll want to know what that is, as opposed to something that might take a few days, which might be our swelling agents. So just cover that and be familiar with that. Adverse effects of laxatives. Usually it can include, the side effect of most laxatives is diarrhea. Sometimes it'll get things moving again, but sometimes we overdo it and we get things moving too much, and now we're on the different end of the spectrum. So sodium and magnesium ions that are absorbed from osmotic laxatives can be harmful, however. It increases the sodium load, which can be dangerous to patients with renal dysfunction, edema, or CHF, congestive heart failure. In addition, in debilitated patients, excess magnesium ions can depress central nervous system and muscle function, so be aware of that. Okay, these aren't necessarily harmless drugs. It can be possible to do damage with these drugs and dehydrate people if we cause them diarrhea. I think that's about all I want to cover in that chapter. Go over the review, become familiar with the questions there, and please contact me if you need any help. Okay, thank you.